All these people coming in, supposed to come in. And then we'll have walk-ins on top of that.
So there's only one ready?
Yes, ma'am.
Okay, you sound really stuffy. Mm-hmm. Are you sneezing too, or what? Mm-hmm. Okay, what has it been going on for?
Oh, it started up, I want to say Saturday.
And you said your nerves aren't doing well?
My depression isn't doing very well. I've been finding myself just getting harder and harder and harder to get out of bed every morning. Just don't want to do anything at all. Feels like I'm having to take care of everybody, and nobody wants to clean up after themselves. I'm having to clean up after everybody, take care of everybody.
Has it ever gotten to the point where you think about hurting yourself? Wish you weren't here?
It has, but then I think about Lily, and that seems to help me stay away from that. Is there another reason why I got love tattooed on my wrist? It's there to remind me that there are people that do love me and need me, and I know my sister would. With us combined, we've lost a lot already, and we don't need to lose each other.
It's great to have that.
Yeah, and I know if anything, I have my sister.
Are we sure you're not pregnant now?
I took 2 pregnancy tests yesterday, and my period is supposed to be showing up in 4 days, and they both came back negative.
Okay, so you might be. What do you want?
I want to have another baby. I want a little boy. I really want a little boy.
If you're feeling worse in the meantime, call me or come in.
Okay.
Okay? Okay, sweetheart.
See ya.
And maybe it's not quite right time to get pregnant again. I don't know.
Oh, if it happens, it happens.
Okay, sweetheart. Hope you're feeling better.
Thank you. Bye. If she closed down, then that means that we'd have to travel to find somebody that would take us. Like I said, right now we don't have any health insurance.
Did they get the pan fixed? Because I sprayed the pan that last time they were here. They said, they can fix it by spraying some. There's some like leak stuff they can put on it. And they said, if this does not work, she's gonna have to get a new unit. Or we can't fix the gaps in the door because there's termites in the wall. We'd have to tear out some of the wall just to fix the door. It's just, you try to fix one problem and there's another problem behind it that's even bigger that you would have to fix just to fix a small problem. And the poster's not on the walls, are mainly covering up holes.
Have health inspectors come through?
No. I'm sure if they did, we'd shut down. When you're in a city like this, what health inspectors are going to come to a rural area like this? I mean, nobody's going to shut down the only doctor's office, in the county. Nobody's going to shut it down.
Let me explain a little about Clay County. We're one of the poorest counties in Georgia. We're not talking about kind of poor. We were talking about this being an extremely poor community. Clay County is underserved, is the polite word for it. I'm the only provider in the county. I've been the only medical provider here for the last 13 years now. There was a hospital here in Clay County. It closed in the late 1980s. The closest regional hospitals are 40 miles away in Alabama or 60 miles in Georgia. It's a long ways to get to medical care here. The county's about 3,000. It's about 60% black, 40% white. the front streets are white on the highways and stuff, and then when you get back beyond that, it's pretty much black. It is kind of how it works. It's all black street. We really don't know what's going to happen. We know if we don't do something, there's not going to be healthcare here real soon. And basically, the whole model has been that nobody else had any responsibility for making sure there was healthcare here. And the county didn't, the city didn't. The first year that we ranked worst in the Robert Wood Johnson Health Rankings, I told the county administrator that, boy, at some point you guys have got to step up. If you want their healthcare to be here and improve, you guys have got to do this. I'll retire at some point, and unless there's some kind of structure, somebody has responsibility for healthcare here, there won't be any healthcare here. Patricia, here we are.
Hello. I thought you were probably looking at me.
How are you?
Okay.
Just okay?
Yes, ma'am. I'm doing well.
Yeah.
I've been in this bed going on 14 years.
14.
Yes, ma'am.
Wow.
If I live to see this year, it'd be 14.
But you'd rather stay here than, move to a nursing home or something?
Yes, I would.
Why?
I worked in a nursing home. I know how they treat those people in the nursing home, and I don't like it. I would rather go home with the Lord than to go to the nursing home. If I don't feel sick, I'm in the Word, or I'm reading, or just writing. I write about my thoughts, how I feel about being in this bed. People, how you have so many friends when you up. But after you get down, it's nobody. It looks like everybody walks away from you. And I try my best to stay up, not to let this bed get to me.
What would you improve about this situation, though, if you could?
I think my situation is good. If I had someone to help me get in the chair,
Where would you go? What would you do?
I'd ride around the neighborhood, get to know the neighbors. I've been here a long time. I never wanted to have to depend on no one. Nobody but the Lord. We couldn't survive without Him.
I grew up in Remington, Indiana, which is a small town, Indiana. My family is in the seed business. Father did well. I've been able to use that background really for support since then. I like to think of it as having just enough money to be dangerous. I eventually decided that I really wasn't going to be able to make an impact with discovering new varieties of soybeans or whatever, so I moved to New York City. Across the street from me, there was a man living on the street, and I had just never seen homeless people before, and I was so struck by that and started volunteering at the New York City Coalition for the Homeless. I was very taken by the physicians who came. They really had an ability to help people there. And so I went back to the idea of that I'd like to go to medical school. Since I'd really come from a rural area, I was very struck by that there were many rural areas that are even more underserved than some of these poor areas in cities. So I literally went to the library and took out a map and a book of statistics looking for poor areas, and ended up relocating to Southwest Georgia, Clay County, which actually that year was considered the most medically underserved county in the state.
Clay County Medical.
so many of the people out here can't pay for care. So I've volunteered. I'm a full-time volunteer, and that's the only way this system works. I have some assets, family money, but they're about exhausted. So there has to be another plan to to allow me to continue to volunteer here. So hey, how you doing?
Same old.
Same old. I know you were here a couple weeks ago, but you're saying you had just started in the flare, right?
Yeah. Wednesday.
But you want to come in before today, or?
I had to, like I said, I have to wait till I get my payroll to come in.
Okay, and of course, we're always happy to see you. If you need to come in, you just come on in, okay? And I mean that.
Okay.
Okay. So you don't feel any better?
Slightly, but the pain is still.
Stand up and let me see where you're talking about. Take a few steps just so I can kind of see. Yeah. And then turn around. And that, your walk, that's not that much different than how you always are, right? How far can you turn your neck to the side?
That's it, right there. Yeah. Almost like a motorcycle.
I mean, basically, it's just cementing his spine in place. It doesn't have the flexibility that you normally would have, so he can't twist. Mm-hmm. He has degenerative disease of your spine. I notice you're kind of a sweaty guy.
Yeah. That's what carrying the weight around all the time.
Yeah. I mean, are you really prone to sweating a lot?
Yes, ma'am.
Okay, so maybe.
Yeah. From hopping.
Yeah. Is it hot in here?
I said from hopping.
Oh, hopping. Yeah.
Yeah.
How long do these flares typically last for?
About 2 to 3 months. Some days be worse than others, but it still be pain. Some days are bearable, some days are unbearable. Unbearable days I just stay out.
Have you been going to work for this?
No, ever since I've been working, like from '96 to now.
Did you go ahead and apply for disability then?
They supposed to call and let me know on what's the interview date.
Good. Okay.
They say you gotta have no income, but how can you have no income and have a house?
And
make
place
you
to
work.
stay.
Yeah.
Yeah. And particularly because the process is so long, it takes about 2 years from the time you apply for disability until you get it in most cases. So, I mean, how are people supposed to live?
Exactly.
Yeah.
Then,
I mean, some people are with their family or something and they can make it, but if you don't have that, it's.
Yeah, for me by yourself is rough.
Yeah.
So you can't stay out, so you gotta go in pain. And it's only so much the job gonna take about you staying out, you know.
Yeah.
I appreciate it. Thank you.
Okay, good to see you.
Hope not to see you too soon.
So I hope Dr. Gordon these are good.
I hope you feel better.
Thank y'all. All right, y'all have a good day.
You too.
Mercer has started negotiations to use us as a model site for rural health care. And so the hope would be that they would be able to partially subsidize us, partly with doing our billing and that sort of thing, and maybe actually some cash.
It's Brandy, Dr. Kinsell's office. I need to see.
I think Mercer is being a little naive by thinking it's just a billing issue. About a third of our patients are on a sliding fee scale. I did agree to increase the minimum sliding fee scale to 15 from 10, which is a 50% increase. It's noticeable. And it will go up pretty quickly from the 15. And I'm sure that will discourage some patients from coming in. Okay.
Such a great doctor.
They were asking for all my data before we had any kind of an agreement. And I go like, no. You know, who the patients are. If you own that data, then you just send an announcement to all of them saying, hey, come to this other doctor down the road. I really don't think they would do that, but I don't completely trust them. Can't trust anybody completely, so I want everything in writing before we move much forward. basically I'm giving them patients, but then they have to agree to employ me. I mean, it wouldn't make any sense for me to give them all that and then, I not be there 3 months from now. We're going to be harder because I'm very serious about the sliding fee scale. If they want to do a sliding fee scale, yeah, I won't do it. I won't. This is the old hospital. And so we're going to renovate that and make it into the new clinic. And there'll be additional services in there, mental health. And we're still negotiating what other new services will be there.
Have you considered leaving?
Yeah, for sure. Have spent all the inheritance, basically. And so I really can't continue to just stay out here for free forever. They, are making arrangements with the county to have that new space. Certainly it would be conceivable that they would just go ahead and put a doctor in that space. I think they would be smart enough not to do that, but that certainly is not inconceivable.
We're at what will be the Clay County Health Clinic. This is a wing of an old hospital here in Fort Gaines, Georgia, that had been not used for many, many years. And we had a group of senators that were traveling around rural Georgia, primarily southwest Georgia, and they came here and we had a huge community meeting. And one of the primary emphasis that we had is the need for a sustainable medical presence here in Clay County. And they took that information back. We were able to get funding from One Georgia Authority. That's part of the money that was the old tobacco settlement money that was received by the state of Georgia several years ago. Through some helpful negotiation with the owner of the facility and the nursing home that is in the remainder of the building, they saw fit to allow us to use part of those funds for health care in our community. It'll be another bullet in our economic development gun. When a retiree is looking at a potential place to relocate, there are two things that they ask about. What are the taxes here, and what about the health care? And if you don't have a good story to tell on both of those, they're probably going to move on somewhere else. If this didn't happen, we'd probably be without a doctor at all.
Let's go ahead and call the meeting to order. And the update from Mercer, Dr. Kinsell and Mercer are still negotiating on her salary. Charles will facilitate a meeting with Dr. Kinsell and Dr. Sumner at Mercer for further discussion.
I was just curious about what the board felt about what would be the priorities for what should go in those spaces. But if this board is the advisory committee for, what happens with healthcare here, y'all may want to weigh in on what you really like to see.
Have y'all considered mammograms?
We have. My vision for Mercer as a whole is if we're going to do several of these clinics, for a more expensive, more specialized diagnostic equipment, it would be portable so that we could eventually have it come to each clinic. There is a company out of Columbus that has reached out to us that is willing to bring mammography here in a portable unit.
We've had aged through 2 sets of mobile mammograms in this community, and they both have lost their grants, so they stopped coming. Mm-hmm. But that was really pretty well used and absolutely is an aid.
If there's any way possible, get some kind of pharmacy in there, because like I say, there's a lot of people just need that here.
Where Mercer can be most effective in partnering with Clay County is the core medical services, to provide medical services to the community. And I think pharmacy falls well within that. Pharmacies are very expensive to run. To run a full-time pharmacy sometimes can be as expensive in just cash flow of, $100,000 a month that just has to be there perpetually. There's always one thing that stands out as the biggest clinic need immediately, and I think that is time with the provider. I think you're tapped out priority number one really has to be bringing in another provider and getting us to a position where we can bring in a nurse practitioner, making sure we've got space for 2 providers, and then I think we move out from there. The other option would be to do a community questionnaire, send it out to the community, and give them a list of services and ask them maybe on a scale of 1 to 5 or 1 to 10, where do these fall into what would be most utilized by each household.
That's the kind of spirit of inclusivity that, we all would like to have, rather than us sit around a table and decide what we'd like to do. How's the smoking coming?
Well, I still don't have the Chantix because they will not take the food stamp thing.
As
They
your proof of
said-
income.
Yes, they said, I meant to bring you the papers from the hospital. so you can see
Okay.
what-
Is there any other kind of proof of income in the household?
There is no income. There's no proof of income. What I'm saying, the only thing we got is the food stamps. I mean,
Yeah. And how much are your food stamps for the family?
$321 a month.
For the 2 of you?
Yes.
Okay, so your breathing is still kind of bad.
He did 2 x-rays at the hospital and said that my lungs are severely damaged.
Mm-hmm.
It kind of was a wake-up call for me because I'd never heard it put like that.
Okay, with the COPD, the
Scared
emphysema.
me.
Yeah. How much are you smoking now?
I would say about 3/4 of a pack, which
Yeah.
is a cut down by 1/4 of a pack, but it seems like when I'm trying to quit, all I think about is smoking.
Sure, it's addictive.
Yeah. Jeez.
I've got some nicotine in the closet. Do you want to try that?
I do.
Okay, let me do that. Let me show you how to do that. So the medicine is in here. There's a little spike in there that's got
Right.
to soak in here. So you kind of line it up, and you really have got to, that's not far enough. You've got to get it so it's almost like a nickel is
Yeah.
all it extends out.
Open the end.
And then you got to put your mouth right on it and press the gray button and suck it in. So I try that one. You got to quit smoking. Yay.
I am working on that for sure.
Okay.
I know I
Okay.
need to.
Yeah, I know it's hard.
It's real hard. It's harder than anything I've ever quit. Like my mom always said, it's my best friend. It is.
Really?
Yeah, I don't make friends real easy. Never have. I don't trust people that good. Besides, I've got 3 sisters. I don't need a lot of close friends.
Are you close to your sisters?
Very.
Okay.
I don't have insurance and I don't have the money to go to a doctor. So coming here it's the only way that I would get medical treatment unless I go to the emergency room every other day.
I collect solar animated figures. Stop in a minute. But they always so were cute. And once you start getting them, every time you see one, you get another one. When we closed at my mom's house, this was my grandfather's rocker, and I think probably predates him. He died young, so I never met him. My grandfather was poor, but he and my father created wealth, basically. And I've dissolved it all. Robert will probably move here when he retires, maybe about 5 years.
Who is your boyfriend?
Robert Cook, he runs a nonprofit in Cordele. He'll continue to live over there for probably several years, but cleared out a drawer for him.
Had you ever wanted kids in a larger family?
I didn't get really coupled while I was in New York City. So by the time I came down here, which was getting close to the end of my fertility, you figure if you don't find somebody in a city of 7 million people, get used to it. I don't know that I'd be that great a parent. I just had other stuff to do. When I first came here, I believe I was referred to as DYB, which stands for Damn Yankee. I had short hair, I wasn't married, everyone assumed I was homosexual. I'm not from here, and honestly, after 23 years here, that still makes a difference. Also complicating that is because there was still the one physician who was here, who also happened to be the mayor, and he really didn't want another doctor in town. A lot of people supported me who, didn't have to stick their neck out because, again, the mayor's people would fight them on it. But because of all those experiences is why, you can't just up and walk away from something like this. This is Brad Liam. He's Dr. Liam is with Mercer. And this is Ronald Walker. This is Dr. Liam. This is Dr. Thomas.
We're trying to help the community. So we have every right to feel confident and good about doing this survey. It's not like we're not asking for money or something like that. So a clinic is important. 10 minutes can make a big difference. If you have a big emergency, or not even emergency, it's nice to have a medical facility in your town. But doesn't it also make sense to ask the people what they want to the clinic? Absolutely. That's what we're doing. What we're going to try to do is try to break up the city into like 4 or 5 different sectors. And then, hey, you guys go to this section, you guys go to this section, and I have a list of streets kind of.
Where's McKinney? Okay, right here on McKinney Academy, there's 8 residents there.
Then again, we're a little oversampling low income.
Right, but we're not doing door to door, we're doing every other one.
But we're still by picking those places to focus on, we're oversampling poverty.
Up around this area, this area?
Well, I know all this here, to tell you the truth. I used to stay down here in the early part when I moved in the country.
Have you been to the Dr. Kinsell's office?
Mm-hmm.
How often do you guys go there? Like once a year?
My mom, she goes once a month.
Oh, why?
Mm-hmm.
So frequently then. What type of insurance do you have?
I don't have any. I have to pay.
Okay.
But my mom, she have Medicare and Medicaid.
Okay. How about diabetes education? How important would that be?
It's very important. 5, because my mom, she has diabetes.
Do you currently have health insurance?
Yes, I have Medicare.
Okay. Does everybody in the household or in this
where
you
no.
live, does it not everybody
He don't
has
have
it?
insurance.
Okay. How important would these services be in your opinion? Smoking cessation, like education to show people how to stop smoking and stuff like that. So would that be not important, do you think, or would that be very important?
Very important because I'm a smoker.
What about behavioral health? Like psychologists or psychiatry?
Yeah, because I take mental medicine, 5.
Okay. What about a local pharmacy?
5.
It sounds like it might be a 6 on that one, huh?
Yes.
What about drug abuse treatment on this?
5.
1 to 5. Okay. Do you have any specialists that you see once in a while, like a heart specialist?
I see a counselor for substance abuse.
Okay. How would you rate the attentiveness and responsiveness or promptness of the staff to you?
I won't really complain. It's anything better than nothing.
Yeah.
You know what I'm saying?
Absolutely.
Even if I'm not one that will just attend or go to the health clinic or whatever the situation is, I would love for my community to have better. This has not been easy in this community. I was born and raised here.
Really?
Yeah, and this is such a rural community. It's a lot of things that we were so deprived of. That's why so many people left and went north or somewhere so they could have jobs and medical facilities. A lot of people want to move back here. They say no. The closest hospital is Dothan. You follow? And they didn't want to come back because they got medical issues. And they was afraid to come back because they thought they might not be able to get to some medical facilities in time. And my mother passed about 3 years ago, and this is what she told me on her dying bed. Whatever you do, get up out of here. You know, get up out of this place. I'm riding the storm on out.
All right, hey, thanks again for your time.
Again, you are doing great. You came back at 2 weeks with your appointment because your sugar was crazy last time.
Yes, ma'am.
And you have done such a good job of bringing it down. Now, you were talking about you drinking so much soda. Are you doing better with that?
Yes, ma'am.
How was she drinking now?
I drink diet soda.
You went to diet soda?
Yeah.
Bless your heart. But you gained 12 pounds. That's probably because you're just not so sick from your sugar being so high.
Yes, ma'am.
I bet you feel better too, don't you?
I feel much better.
So I'm gonna order you one more medicine. You know, someplace would be good for you to get your pills from. These people. They'll send you pills for free. Your girlfriend was here last time. Is she good with a computer?
Yeah, I think my sister had one.
Okay. Or they use it on their phone?
I think so.
Okay.
If you are a new patient and need to register, press 1. If you are a current...
And nobody has an email then. Okay. This is Dr. Kinsell, Kinsell at Clay County Medical Center. So many of our patients don't have emails, so we can't register email. And it won't take the phone without that. You tell them they said they would send us faxable forms down, said that the other day.
That was a doctor, yes ma'am, was trying to, like I say, doesn't have an email address.
What they're gonna do is they're gonna send you 3 months of this one and the 2 new ones. And then they're gonna send you a bill for $6 for that first time. And then you can send them a money order or something back. So it does work out quite a bit cheaper. So we can make your point back next month, and then if you keep doing so, go to make it back every 3 months or something.
Okay.
Okay?
Okay.
But you've done your job. Now just figure out how to use the machine so you can,
Okay.
because you can figure it out if you can check it maybe once a day. Well, we're still talking with Mercer. They seem to have changed their plans for this clinic. The plan was always that they would take care of the poor people who live here. There was talk about a minimum sliding fee schedule starting at $15, but that no one would be turned away. They kind of questioned that we needed that. I think we've resolved that, but it just makes no sense for healthcare to be open in Clay County if we can't see all the people who are here. And of course, that's the reason I'm here, and if I can't do that, I won't stay here.
Hot dog.
I certainly hope and expect things will still work out with them. I'm not sure in what manner.
Our walk-ins are from 7:30 to 10 today.
I haven't seen you in, gosh, almost 2 years. Okay, so you've been going to school?
School on now, online classes now.
You're online now.
Yep, 3 online classes.
How's that going?
I'm doing fine. I got A's and B's from that.
So your major would be computers then?
Yeah. Okay. Yes, ma'am.
So
what's wrong with you? What you don't do at night?
I said I can't sleep.
And I heard him at 3 or 4 o'clock in the morning.
So
that's the TV.
No, I heard you. That's what you say. You be making noise and stuff.
I was a little singing.
if we do think he has sleep apnea that's not treated, if you make him more drowsy, that could actually be kind of dangerous because the snoring is kind of him waking up a little bit almost.
Mm-hmm.
And if he's more drugged out, he won't be able to wake up as much. So if he's ready to go ahead and do a sleep study, that would be real important to go ahead and do.
I also want my ambulance so I can go to sleep. So I'm gonna be up when he'll be asleep.
And again, we worry about doing that because if you do have sleep apnea, if we sleep harder, you may forget to wake up.
Oh, believe me, my bladder's not gonna let me forget to wake up.
Well, it only takes about 4 minutes to be a problem. I know you've tolerated it before, but it is a worry. Okay? Okay,
right.
so take that out. Good to see you, darling.
Good to see you.
And good night. I'm real proud of you. Real proud of you.
We have to go out of town for every other doctor. Like we was talking about the dentist. When we actually had a dentist right here, and they turned the dentist off to a lip store.
Mercer has told me from the beginning that they would hire me, although at a very low salary. And then they literally came down and signed the agreement to get the lease on the building that's being renovated and drove over here and told me that, they decided not to hire me. I was completely devastated. Could not function. I think really it has more to do with that they do not want to honor their commitments, their repeated commitments to offer affordable care here. When they open the clinic, I think they're primarily expecting people who have insurance.
Now, big breasts?
And, that kind of makes sense, except for the fact that Clay is one of the top 5 uninsured counties in Georgia, one of the poorest counties in Georgia, and has a worst health status in Georgia. I couldn't envision at first even being able to stay open here because I assume they'll take some patients, but I'm going to stay open. I can't abandon my individual patients and knowing that they're not going to get the care that they need. And so I can't leave. You can't just walk away.
Okay. Have a good day now. Take care now. Take it easy.
I say I want to work for another 5 or 10 years till I'm 70 or 75, but, I don't have much of anything saved up for retirement. So I have to be working part-time even to sustain myself. I started work as the medical director at the methadone clinic in Columbus. Right now I'm getting up at 3:45, 4 days a week, and that gets tiring. I presume Mercer is still planning on opening. I don't know what'll happen when they open. I mean, they may suck up everybody over there.
We visit Dr. Karen Kinsell. She's the only physician in Fort Gaines, Georgia, where she serves her town's 3,000 residents.
Our office was not built as a doctor's office and really shouldn't be a doctor's office. There was a PBS piece that aired about 2 months ago, and they had told us, be sure you have a Facebook page and everything because you're going to get a lot of donations afterwards. And I kind of poo-pooed that, but we just started getting letters and donations in the mail. Got some phone calls, but most people just mailed things. This is the grocery bag of letters we've gotten from people who sent us money. This is from California. Hello, we heard about the extraordinary work you do on the NewsHour. Hope this helps a little. Take care. So far it's been a little over 30,000. People have no idea how touching that is, that someone happened to see that piece and mailed a check. I mean, it's just astonishing. And I feel inadequate. What is a good enough response to thank them for this? This is from Tennessee. This is from Maryland. I'm going to be able to purchase the building where the clinic is. The estate that we've been renting it from is giving me a very reasonable price.
Termites ate it right up.
We closed for COVID and knew we had this opportunity to make some major renovations to the office. I think it will maintain our patient base, probably attract new patients, and prevent the building from just rotting out in the meantime. We knew this building had to be upgraded one way or another, and I didn't see how I could afford to do it. It's really been a lifesaver.
This is to the nursing home through these doors. Medicine storage, samples, vaccine storage, refrigerator, nurses' quarters, and this will be the doctor's office. This room is going to be primarily telemedicine, and then x-ray room.
When are you all turning this over to Mercer?
A couple weeks, I would guess. It is happening, thank goodness. After years and years, it is happening.
Although I should put the pearls on here.
We met on OkCupid, yes.
Yeah, let me take the pearls out so you can put them on.
I couldn't believe that I didn't know her already because she was writing about being interested in social justice on OkCupid. Hadn't I missed this woman in South Georgia? We've lived in separate towns the whole time. We've been commuting about 2 hours each way on weekends for going on 12 years now.
So your ring is here.
My ring is there.
And this is the...
That's the Green Lantern ring, in case we should want to get married with a Green Lantern ring, yes.
Well, we decided to get married because, we see death and illness all around us, partly. My paternal grandmother died when I was in college. Her engagement ring, I had it reset to this, and I've really never worn it. And Robert has his
great-grandfather's ring. We think it's, the family says that the provenance is European.
Well, and honestly, that's been my big issue about marriage in the first place, is something could happen, and I don't want to have to argue with hospital personnel about, do I get to see my beloved? We both had the commitment. We got a commitment to a long-term monogamous relationship, and that's what it is.
Okay.
Yes.
Okay. And I think we're live. We're live! And here comes the bride. Oh my gosh.
Oh, they're pretty.
Oh my gosh. Look at how pretty.
Where'd y'all order them from?
Tissa's in Eufaula.
Karen, let me just borrow you for a minute. Let me step around the corner and get the other ring. Let me borrow you for a minute.
Get it off. It's going to be awkward if I have to.
This is kind of like, you get it?
There it goes.
Yeah, okay, good. Maybe that's not the right place.
Maybe that's not the right.
Yeah, absolutely.
Beautiful.
Thank you.
All right, one more.
Thank you. Thank you.
I know you're tired.
Yeah. Walk slowly.
I, Robert,
Take you, Karen,
take you, Karen,
to be my spouse and partner in marriage.
to be my spouse and partner in marriage.
I, Karen, take you, Robert, to be my spouse and partner in marriage. To be my spouse and partner in marriage. To have and to hold. From this day forward.
to love and to cherish
to love and to cherish
until we are parted by death.
until we are parted by death.
This is my solemn vow.
This is my solemn vow.
You may kiss.
Yeah.
I really feel more energized than I have in years. It's such a privilege to know that, you're needed and good at all these areas. It's almost like magic. I thought we were just going to have to close when Mercer opened, and that's not been the case at all. We've been able to keep the office open, and actually the clinic is now paying me some. How's your breathing doing?
My breathing fine, but my side.
We'll continue to see people regardless of their ability to pay, but the reality is that is the reality here. People cannot afford to pay for health care. If I leave town or drop dead or whatever, there isn't anything, people won't get health care. So I really worry after me, again, what do you do with the poor people?